On June 12, 2025, the U.S. FDA approved Zusduri, a mitomycin intravesical solution for adult patients with recurrent low-grade, intermediate-risk, non-muscle-invasive bladder cancer. What makes Zusduri unique is its reverse thermal hydrogel formulation. It is administered intravesically via a urethral catheter, as a chilled liquid. Once inside the bladder, it warms and transforms into a semi-solid gel, forming a localized drug depot. This allows sustained exposure of the bladder urothelium to mitomycin while being administered in an outpatient setting. The approval is based on the ENVISION trial, a Phase III single-arm, multi-center study in 240 adults with recurrent low-grade NMIBC after TURBT. So the key eligibility criteria included having multiple tumors, a solitary tumor greater than 3 centimeters, or recurrence within 1 year. The treatment protocol was 75 milligrams, given once weekly for 6 weeks through bladder installation. Efficacy outcomes showed that 78% of evaluable patients, which was 223 individuals, achieved a complete response at 3 months with a confidence interval of 72% to 83%. Among those who responded, 79% remained disease-free for at least 12 months. The duration of response ranged from 0 to more than 25 months. So this is actually a clinically meaningful response in a population with, pretty limited options after prior resection. The most common adverse events occurring in at least 10% of patients included elevated creatinine and potassium dysuria, elevated liver enzymes, hematuria, and cytopenias, such as decreased hemoglobin neutrophils and lymphocytes, along with urinary tract infections. Serious adverse events were seen in about 12% of patients, including urinary retention in 0.8%, urethral stenosis in 0.4%, and there was 1 fatal case of cardiac failure. The recommended dose is 75 milligrams, which is 56 milliliters of mitomycin solution. It's instilled once weekly for 6 weeks, and the medication is delivered via a urinary catheter. Although this therapy is administered by urology, primary care providers play a key role in recognizing recurrence risk in non-muscle invasive bladder cancer, coordinating timely referrals after transurethral resection of bladder tumor, monitoring renal and hepatic function, managing symptoms like dysuria or urinary tract infection, and supporting survivorship care. This is CARES, keeping you informed on cancer care advances that matter in primary care. If you found this helpful, go ahead and subscribe and share to stay updated on FDA approvals and clinical insights.